Hi everyone, I'm Nicole Adams, and today I'll be discussing Alzheimer's disease in rural populations. Alzheimer's disease, or AD, is the most common subtype of dementia and results in neurological decline that can impair an individual's cognitive and physical functioning. The most well-understood risk factors for Alzheimer's disease are old age and family history, so as the United States population ages rapidly, Alzheimer's will only become more prevalent. The Alzheimer's Association estimates that AD will cost the United States $355 billion in 2021, with the largest payer being Medicare. Rural populations are particularly vulnerable to the issue of Alzheimer's disease, as these individuals face issues with access to healthcare and tend to be older. The maldistribution of both primary care physicians and specialists in rural areas creates a disparity in access to care that may lead to underdiagnosis of Alzheimer's. According to Abner et al., early diagnosis and intervention are critical with this disease, as there are methods to delay the onset of severe symptoms, and early diagnosis allows coordination of care for these individuals. Transportation may also be an obstacle to receiving care for individuals in rural areas, depending on their proximity to healthcare facilities. In addition to the lack of access to care, rural populations tend to have a larger proportion of elderly residents, meaning that they're disproportionately affected by disease with age as a risk factor. Other predisposing characteristics of individuals living in rural areas include a lack of knowledge about the signs of Alzheimer's disease. Misconceptions or failure to recognize cognitive decline can once again lead to underdiagnosis. Alzheimer's Disease Research Centers, or ADRCs, are an invaluable resource to individuals with Alzheimer's and have recently received funding by the National Institute on Aging to expand their aid to rural populations. ADRCs offer support for individuals with Alzheimer's and their families by providing diagnostic and disease management services. These centers provide information about the disease while also connecting patients to ongoing research studies and trials. Despite the work done by ADRCs, there's still room for improvement in the access and cost of care for individuals in rural areas. A sense of community is a primary value of most rural populations, so any intervention to target Alzheimer's in these areas should involve the community. A study conducted by Blocker et al. Suggested community-level risk reduction through education about high-risk behaviors and protective factors that may reduce risk. This intervention strategy has the potential to lower healthcare costs by decreasing the number of individuals who will develop Alzheimer's disease. Education on the individual level about early signs of Alzheimer's disease can end the lack of knowledge and awareness in rural communities. This knowledge may encourage individuals to seek diagnosis earlier, leading to more effective early intervention and improved patient outcomes. I believe that telehealth has the most potential to improve the lives of individuals with Alzheimer's disease in rural areas. Widespread implementation of telehealth would remedy the issues of maldistribution and transportation by allowing residents of rural areas to connect with providers around the country. This increased access to care would allow for regular screenings for any cognitive impairment and other preventive care. Patients would experience enhanced quality of care with access to Alzheimer's specialists regardless of geographic location. Now for my discussion question. What other medical technologies could also be valuable to this special population? These are my sources, and thank you.